Hello, hello, hello. It's me again, Dr. Tassone. Just wanted to do a little post today, maybe a little bit longer than some of my other ones, on female birth control options and just kind of, what's out there, what's available, and what kind of side effects, profiles, things like that that you can expect when using different forms of birth control and why you would want to use different forms of birth control. Obviously, the first method of birth control, which is probably the least fun, would be abstinence, which we talk about that a lot. It hasn't worked as far as teenagers go, preventing pregnancy rates per se, but obviously that would be the ultimate type of birth control. Secondarily, we look at things like there's not semi-permanent, but not permanent birth control that lasts for years, one of those being what's called Nexplanon. Nexplanon is a progesterone-only insert that goes under the skin of the arm, right about here. It's about 2 to 3 centimeters in length, or 3.5 centimeters in length, somewhere around there. We numb your skin up in the office, and then it goes in the arm. It takes about 2 weeks to really kick in, so I recommend women use other form of birth control like condoms prior to unprotected sex. It obviously won't protect against different forms of sexually transmitted diseases, but it's great in the sense that you don't have to think about it. It works for 3 years. It has only the progesterone aspect, so side effects are not going to include the estrogenic effects of deep venous thrombosis and breast cancer that you might get with pills, or some of the estrogen dominant effects that you might get with birth control pills. Nexplanon is a surgical procedure in the office. Takes probably 10 minutes or less to perform. You might have a little bruising of the arm where we do the insertion site, but you're in, you're out, and it's a relatively good form of birth control in the sense that it lasts for 3 years, and for those women that can't remember a pill daily or have a contraindication for estrogen, this would be a good form of birth control. Next would be the birth control patch, or the Ortho-Evra, which has been around for a long, long time. I probably prescribe that now maybe once a year. Most women don't care for it. I have seen a lot of side effects with acne and irregular bleeding. It's a patch. It's once a week, so it's 3 weeks on, 1 week off, and then another 3 weeks on, 1 week off. There have been some studies that show an increased risk of deep venous thrombosis. That's why you might have seen the patch on some of the legal commercials that come on these days, that the company may have been involved in a lawsuit. I'm not really going to get into that. I think that it's still a fairly safe form of birth control. It just has higher release of estrogen at times, so you might get some of those side effects. Like I said, most instances it's not something that's even requested by patients these days. The number one form of birth control are obviously the birth control pills. It's been around since the 50s. The pill dosages, when they initially came out, were a 50 microgram pill. They went down to 35 microgram pill, then a 30 microgram pill, then a 20 microgram pill, and now we're down to 10 microgram pills. So the pill dosages now are close to 1/5 of what they used to be, which has significantly decreased risks. But there are still risks, primarily being things like nausea, occasionally vomiting, breast tenderness, irregular bleeding. But higher on the spectrum is going to be, deep vein thrombosis or blood clots in the legs, and increased risk of breast cancer. However, on the positive side, you can have up to a 50% decrease in ovarian cancer risks by taking the birth control pill for a combined 12 months during your lifetime. And that's because of the ovulation suppression. The downside to birth control pills is you have to remember to take it every day. If you miss a day, you have to take 2 the next day. If you miss more than 2 days, I usually recommend that you have some sort of backup until you have your period. You will also need to protect against STDs. But for some women who have bad periods, it can regulate periods, it can decrease bleeding and pain, but it obviously does have risk. It's a medication. I would recommend making that decision with your physician and seeing if it's right for you. I will also recommend for women that they try to take it at the same time of the day. So putting it by your toothbrush or something that you do daily I've had people tape it to the fridge, but the problem is you go to the fridge so much that sometimes you don't see it after a while. So something that you're doing daily, but maybe not all the time, would be a good way to go about using the pill. Birth control injections, or Depo-Provera, is not probably something that I use hardly at all, except for in very young women who specifically request it. The thing about Depo is that it is a synthetic progesterone, as are the others like Nexplanon and Mirena. The problem with Depo is you give a large injection into the gluteal muscle, and it takes about 3 to 6 months for that medicine to wear off. If you don't like the side effects, which can be things from headache to weight gain to irregular bleeding, and I have seen some patients with mood disorders, whether or not they were caused by the Provera or just exacerbated. But the problem with the medicine is if you don't like it and you have bad side effects, you can't get rid of it. It's in there for 3 months, and you have to ride it out. The other thing that Depo-Provera will do that most of the others will not do is that it will suppress ovulation and can possibly even suppress it up to 9 months to 12 months after you have your last injection. So if you're doing Depo and you think you might want to get pregnant, soon, or you're talking about family planning, I wouldn't use Depo because it can take you a while to get those hormones back in gear, to get the cycle going again. I don't personally like Depo-Provera. I don't use it very often, as I said, except for in those. Usually it's a younger woman who is either with her mother and the mother requests it, or the patient requests it because she knows that she just simply isn't going to be able to take a pill every day. Obviously, there's the sponge, which got memorialized on the Jerry Seinfeld show. The sponge is back. The sponge is fine. It's just that you have to put it in, which means you have to know when you're going to have sex. And it means that you have to be aware of the fact that you probably need to use it with a spermicidal gel unless that comes with the sponge. And then you have to take it out. What I have found in this population of younger millennials is that they're not quite as comfortable as a group doing that type of thing as maybe the folks in my generation or the 30-year-olds. And so the sponge may not be a great contraceptive for a woman who is not comfortable enough with her body to place and remove the device. Piggybacking along with the sponge then would be the NuvaRing. The NuvaRing is a circular device that's very flexible, and it goes in similar to the patch, it goes inside the vagina for 3 weeks. So it's a 3-week on, 1 week off birth control method, which adds a little bit of a nuance. There is an app to remind you when to remove it and when to put the new one in. So the NuvaRing goes in for 3 weeks and then comes out for a week and then goes in for 3 weeks. There was a bit of a to-do, again, on legal channels about the NuvaRing causing increased blood clots and things of that nature. I don't necessarily think that it's any riskier than any other form of birth control. It is good, again, for those females that aren't necessarily into taking a pill or that want to not be bothered but every 4 weeks about removing or putting a new one back in. I think it's a good form of birth control. My own child used it, and she did well with it. So I think it's definitely a good option for most women. Another form that sometimes we don't think about is breastfeeding. Breastfeeding is a decent form of birth control. It's about 80 to 85% effective. You have an increased level of prolactin in your body, which then helps to suppress ovulation, and prolactin is what helps you make breast milk. The problem with breastfeeding is it's not perfect. None of them are. But it doesn't help. You don't know when you're going to ovulate. So you might throw an ovulation into the mix when you're not having periods because you're breastfeeding, and so there's a potential risk for getting pregnant. Women that do decide to breastfeed that want to back up and don't want to use condoms, there is a pill called Micronor. Micronor is a progesterone-only pill that works well with breastfeeding, and it doesn't change the quality or content of the breast milk. Neither would a Iud, a Nexplanon, or a Depo-Provera injection. All the other forms of birth control could decrease the quality and quantity of the breast milk. If we look at the barrier methods like diaphragms, condoms, and cervical caps, Condoms are probably the most widely used of those three options, and really they're great because they do help you get protection from STDs and other issues like abnormal pap smears and HPV. The diaphragm and cervical caps may work as well. I can tell you in my 20 years of practice, or 17 years, I've probably fitted about 3 to 4 diaphragms in my professional career, and I've never had a patient with a cervical cap, only because of the burden of using them. You have to be very diligent about putting them in, especially with the cervical cap. You have to be diligent about getting it in the right place. It's obviously a more natural form of birth control, but they do have latex, so if you're a latex allergy, that may not work for you. But it's another option. The barrier methods do work. They're just not as effective, and you may need to use backup. Female condoms are also available, in my opinion. I've never seen anybody use those. I'm sure there are women that do, but I have not had a patient that has spoken about them. They are a condom that is basically a baggie or made out of condom material, latex, that goes in the vagina. And to me, it just doesn't seem like it's going to be something that is going to want to be used, because it's difficult enough to put on a male condom to take the time out to do that. In order to put in a female condom, it's way more burdensome, and I just don't think that women of this day and age are going to want to use it. I don't really talk about it because of that issue. Natural fertility-based methods like NatPro, Creighton method are going to look at things like calendar timing. You're going to have to be very diligent about your cervical mucus, about your body temperatures, and you're going to have to really know your body and be comfortable with your body to know when you're ovulating. And this method works wonderfully. I know many of my patients that use it. It's a great method of birth control. It just takes a patient that is very diligent and wants to do things in a natural method to the point where they're willing to take control and do the things that they need to do, like collect their own cervical mucus, take their body temperatures, and keep a calendar so you know when your fertile times are. It's also better for women that are regular in their cycles, because it helps you find out when you're ovulating. If you're extremely irregular in your cycles, it's going to be a little bit harder. Still can be done, but it might be a little bit more difficult. The IUDs, you've got Skyla, Paragard, Mirena, Latrell. Most of these IUDs, with the exception of Paragard, are progesterone-only containing IUDs. The Paragard is a copper IUD. Copper is toxic to sperm. That's how it works. You obviously can't use the copper IUD if you have a excess of copper in your system, or Wilson's disease, which is extremely rare. The IUDs are probably one of the most commonly used forms of birth control. It is a foreign body inside the uterus, so many women don't want to use it for that alone. It's a progesterone-only device. It works by thickening the cervical mucus and thinning out the lining of the uterus so that pregnancy can't happen. Some women don't want to use this form of birth control because it is an abortifacient, meaning the egg could still potentially get fertilized and then wouldn't be able to implant. And for those who have a belief system that that's an abortion, they may not want to use this type of birth control, which is totally understandable. It's just something that most women should know prior to, so that they know whether or not this is something they would like to do. The IUD is just as effective as having your tubes tied. It's just it's not permanent. It has about a 1 in 1,000 failure rate when looked at 1 year and at 10 years after insertion. So it's an extremely effective form of birth control. The Mirena is currently a 5-year IUD. The Skyla is currently a 3-year IUD. We may see those timelines changing. They may get a little bit longer as time goes on. There are new IUDs that are coming out in the near future. My favorite type of birth control for women is the vasectomy, tongue-in-cheek, because you guys don't have to do anything, and it's really the one time in a male's life right now where he can actually do something to prevent you from getting pregnant. There's no risks at all to you, obviously, with a vasectomy. It's just making the sell to your husband that it's something that he should do and that he should want to do. The vasectomy is done in the office, at a urology office or a family practitioner office who's comfortable doing the procedure. It's not a very lengthy process. There might be a little bruising and a little bit of discomfort afterwards, but it's extremely effective. works just as well as having your tubes tied, and has zero risk to you other than having a whiny husband for a couple of days after the procedure. Finally, other than withdrawal, which in my opinion doesn't work very well, because sometimes the man can have a little bit of release prior to orgasm that will have a little bit of sperm in there, and that can cause pregnancy even if there's, a few hundred or a few thousand. So I would recommend not using that. The other thing is, and finally, other than male sterilization, would be female sterilization. And there's different types. There's the type of sterilization we do at the time of a cesarean section, which I do believe if you're going to have a C-section and you do want permanent sterilization, that's a great way to go, because we're already there. We're already looking at your fallopian tubes. I wouldn't recommend a vasectomy in those instances, only because you're already having the surgery. So at that point, I would say he doesn't need to have the vasectomy if you're going to go that route. A laparoscopic tubile is where we put a camera in the belly button and we either burn the tubes, we put a clamp on the tubes, or we put a fallope ring on the tubes. I prefer the burning method because it doesn't leave a foreign body in your system, and therefore there's little or less of a reaction to you personally. The failure rates with tubiles tend to be about 1 in 1,000 at 1 year, and possibly as high as 50 per 1,000 at 10 years. Their safety is based on their type. So obviously a surgical method is where we're in your abdomen is going to be a little riskier than a vasectomy because we're in your abdomen. There is a procedure called Iuds that is a coil that goes in the fallopian tubes that's placed intrauterine or through the vagina and cervix. I have spent the majority of the last 3 years removing the Iuds coils. I have seen some side effects from them. I don't personally place them anymore. It is something that does not work permanently in many instances or in a certain percentage. That's debatable. There is some research to show that, however. I personally don't feel as though it's a great option for my patients. I don't recommend it, as I have been taking them out, which is a surgical procedure, and in most cases was winding up with a hysterectomy. The hysterectomy in and of itself is the ultimate form of birth control. In those women that have hysterectomy, you don't have a uterus anymore, so obviously you won't be able to get pregnant. In a woman who has a uterus, there's always a chance you could get pregnant, regardless of whether or not you have the fallopian tubes in place. Sometimes you've had the fallopian tubes removed, you've had ectopic pregnancies or another procedure. Even if you don't have fallopian tubes, you could still potentially get pregnant, although extremely rare. If there's anybody out there that has any questions about birth control, feel free to type them in right now, or even type them in later on, and I'll be more than happy to answer them online. As I said, I wanted to have some things here to show you. I couldn't round them up right now, but I'm going to get some pictures of things. If you're not familiar with what a NuvaRing looks like, you can see it. If you want to know more specifics about a different form of birth control, again, let me know. I'll go ahead and post it online here, and I can give you some more specifics. As I said, I think that most methods of birth control at this point in time are relatively vetted, some more than others. Some obviously are going to be a little more controversial than others. The most controversial thing to me is I feel, and I've written articles on this, how men have failed women in the sense that we don't take any of the burden usually with birth control other than condoms and vasectomies. There are some male birth control methods that are coming out in the next few months that decrease sperm counts and decrease sperm motility. The question, and they are pills and gels. The question is whether or not men are going to use them. It'll be really interesting to see if men do use them, because in my opinion, women have been made to bear the burden for so many years. I think it's going to be a difficult sell to get men to take on the burden of birth control. Again, let me know if you have any questions, and I look forward to answering them in the future. Take care.